If you or someone you know has diabetes, this video is for you. Hey everyone, this is Dr. Khan. If you're new here, welcome. I'm a surgical podiatrist that specializes in treating diabetic wounds and limb salvage. Today I wanted to discuss in depth what diabetes is and how does it affect your feet. Now you may have heard of or even known someone that has lost a toe or foot or leg to diabetes. But how does it happen and what can you do to prevent it? Well, there are different types of diabetes. Type 1 is an autoimmune disease where the beta pancreatic cells responsible for producing insulin are destroyed by the body's immune system. While type 2 diabetes, which is more common, is often referred to as insulin-resistant diabetes where the body doesn't use insulin properly. Insulin is a crucial hormone that acts like a key which helps move glucose or sugar in the blood into cells for energy and storage. Both types can lead to increase in blood sugar. But what does having too much sugar in your blood have to do with your feet, you might be asking? Well, having high blood sugar that goes untreated will chemically alter nerves, damage the small blood vessels supplying them, and creates oxidative stress, leading to impaired signal transmission. This typically starts with the smallest vessel and nerves which are in your extremities. So prolonged increase in blood glucose can lead to nerve damage. When this happens, your ability to feel small cuts or blisters on your feet which go unnoticed and untreated and turn into ulcers or open wounds. This alone would be bad enough, however, diabetes also causes damage to blood vessels, causing narrowing and hardening of arteries and arterioles, leading to decreased blood flow to the feet. And lastly, the high blood sugar feeds the bacteria, causing them to multiply exponentially. This all leads to a perfect storm. You may have a cut that you haven't seen which is now an open wound. Lack of blood flow which is causing restricts your body's ability to send in white blood cells to fight off infection. And you have bacteria that is reproducing fast due to elevated sugar levels. This is the perfect recipe for a gnarly infection. If the infection goes untreated, it can cause sepsis or infection in the blood, gangrene both dry and wet due to lack of blood, and osteomyelitis which is infection of the bone. Once the infection gets into the bone, the only way to treat it is to surgically remove the infected bone. Sometimes long-term antibiotics can help turn an acute osteomyelitis into chronic osteomyelitis, essentially putting the infection to sleep. But like a sleeping dragon, there's always the possibility that it may wake up and wreak havoc. So now that we've talked about how diabetes can lead to amputation, what can you do to prevent it? Well, the first thing to do is make sure you're keeping up with your diabetic medication and checking your blood sugar levels daily. A continuous glucose monitor or CGM is a great device that gives you real-time information about your blood sugar. Preventing diabetic neuropathy is the best way to avoid amputation. Secondly, daily foot exams will help catch small cuts or openings sooner which can be treated before they become a problem. Lastly, keep up with your podiatrist for regular checks and nail care. One of the most common causes of amputations that I see are from diabetic patients with neuropathy that attempt to cut their own toenails, accidentally cut themselves without noticing, and that turns into a massive infection. Thank you for watching. If you found this video helpful, please like, comment, subscribe and share for more foot care tips.